He's a gastroenterologist with a specific interest in pediatrics, as well as he currently works for MGM Healthcare. Once again, a very welcoming good afternoon to both of you all and to the team and the parents here. Over to you, Sarita, for just giving us the flow and the Zoom etiquette here.
Good afternoon, everyone. Just to let you all know that we just adhere to certain Zoom etiquettes so that the meeting goes seamlessly. First thing is that we request all of the audience video and audio to be on mute. This is to ensure that we don't end up in any network bandwidth issues. The doctors, Durga's audio and video will be on. The rest of us will go on mute. Secondly, the questions that you have asked already is being shared with the doctors, and that will be asked by Durga. And if there are any follow-up questions, request you to post them in the chat. One of our moderators will take it up later and ask the doctors. However, in the course of time, if you find that there is something that you want to ask, you can always turn on your video, raise your hand. One of us will keep a tab on who is it, and then you can start asking your question when it's the right time to ask. That's pretty much it. That's all. Looking forward to hearing more from Dr. Chezhian and Dr. Arul. Prakash. Thanks.
Good afternoon, Arul Prakash.
Hi.
Hi. Good afternoon, organizing team of Mira and fellow parents. So I'm first of all, I'm a proud parent. That is the first thing. Second is I'm a Mira parent. Okay. So the two words enough to describe me. And I hope a very good session during this evening. We share our experiences to the best possible effort to benefit our parents and our kids. With this, we can move forward to the session now.
Yes, Doctor. Doctor, if you have any presentation to do, you'll have both co-hosts here, so you could just start doing that. After that, after the initial overview, we could have the question. Yeah, okay. Yes. Dr. Arul Prakash, you may want to say a few, or you could start off.
Yeah, that's fine. Yeah, thank you. I really feel honored to be here today. I mean, it's like I like discussing, healthcare issues with our, general public, basically. I mean, because one thing, it's easy, like whatever you can tell, and unlike in medical scientific forum, you don't have tough questions or doubts to be raised and no controversy. So I like sharing my mind. I'm really happy that you have come up, and honestly, I feel honored to be here with parents. And I know Dr. Chezhian for a long time, and this is a good cause. And this next 1 hour I'll be sharing my experience, like few of the patients, and we have seen some families who has GI issues. They have consulted us, and we did understand some issues. So I will just give an overview, and then Dr. Chezhian will also contribute his thoughts in it, and then we'll go with the doubts which we can try to clear it. So to start with, this is a complex issue, basically, because the numbers are not so high that they have not conducted huge studies in India, basically. So many of the studies are conducted abroad, and we are just extrapolating that. So there is a big difference in dietary habits, food habits, and everything in different countries. So I did discuss with two of my known colleagues. One is a senior dietitian and one a pediatric neurologist, to understand a little more, because they do have a lot of experience. So I did had some idea from them. So good afternoon all. Then with further thing, I'll just start on the small presentation, just to take you through. I'm just sharing the screen now. It's a it's a small PowerPoint slide. So what are the common GI issues which we encounter in neurodiverse children? So we all have to understand that gut is called the second brain. This is because um, serotonin is a neurotransmitter hormone which is present in the brain. It communicates, the neuron communicates to another neuron through this neurotransmitter called serotonin. And it's surprising that this serotonin is more in the intestine rather in the brain. So the newer research and concepts in every disease are connected to the intestine. They say in lot of diseases, gut is involved, and microbiome. Microbiome is nothing but the bacteria, millions and billions of bacteria in the gut determines one individual and their health in terms of um, um, almost all organs. Like say, even in fatty liver, they are saying that gut bacteria plays a role. So in even neurological disorders, gut bacteria has a role. So these are all postulations, and there are evidences coming up here and there. So gut is connected very closely to the brain. So there you would have heard something about IBS, irritable bowel syndrome, which which is a disease. It's not a disease; it's a variant, or people who have this IBS. They have a very good connection with their brain, what they call as gut-brain axis. When there is a stress, you have more GI trouble. This is how it happens. So, so what are all the issues and why we have these issues? In this group of children, there is a strong and significant relationship with GI symptoms. You all agree with that. Like say, when you have an aggravation in the GI issues, like say diarrhea or constipation, you feel that they are more irritable or socially withdrawn or more stereotypic activities and hyperactivities, which is well documented even in literature. So what they feel, it's a coping mechanism for an uncomfortable GI condition. Say this is a mechanism where the child reacts to it. Say we react by saying that we have bloating or pain or discomfort, but this group of children doesn't have a mechanism to cope up. So behavior is a mean of communication for them. So no wonder any distress will be reflected as a behavioral change. So that's how the issue starts with. And when you underestimate that, what happens is like you tend to give nutrition which is not complete. So they'll end up with multiple vitamin deficiency. Indirectly, it contributes to their growth and even for brain growth, basically. So that is the whole issue which we are concerned about. Going to the common problems, GI problems, first and foremost is feeding issues. Many of our kids are, we are finding difficult to feed them because they have a food selectivity or food dislikes. This is primarily related to a ritualist tendency where they have a choice and they want to have a stereotype side of sort of food. Like they will choose some food which they are convenient to, and if you give something else, they are not able to accept it. So it's a sort of a phenomena which happens, and they need to be a routine. Like say you are giving some texture or some temperature of food or a taste, they want to have the same diet, and it should be routine for them. So that's what they expect. That's the reason going beyond is a problem. So this food selectivity is a big issue, which is, very difficult to handle. There is no one point solution for that. Then comes the food intolerance and allergy. See, even with adults or normal development children and kids, there are multiple issues. See, people would have your own families, you would have seen like many children have cow milk allergies, and predominantly I'm talking about cow milk allergies and any other diet for that matter, but common is the milk and milk related Generally, if it is a milder form, they will develop some symptoms like bloating, passing excess flatulence, and if it is severe enough, they will develop some issues like itching of the skin, or very dramatic that we understand, okay, this food has caused you the trouble, so we knock it out. But when it is very mild, it's very difficult to find even in a adult. Here is a child who is not communicating with us well. It will be difficult to find out the intolerance and then correct it. So we have to keep a close watch. And there are multiple controversy about this diet of gluten-free and casein-free diets, which and these sort of issues are very significant in our group of children. And having left, other important problem is reflux disease, gastroesophageal reflux disease. Since communication is getting a little difficult here, we don't know how much we are feeding the children. Sometimes we may be underfeeding them or overfeeding them. In overall, all pediatric age group and children are at that too in a very younger age are prone for this gastroesophageal reflux. It's nothing but the food pipe and stomach junction is little loose, and the acid and the contents of the stomach escapes up and it irritates the food pipe. Generally, you would have experienced a heartburn when you eat a little more or a fatty meal. That is because of this reflux. And you strain a lot, you laugh, or you stress yourself, this valve opens and the acid goes up. So you feel a heartburn and you are able to communicate. Whereas in children, they cry. In normal children, they do activities like, say, in a 1-year-old, 2-year-old, if you have a reflex, what they do is they cry a lot. They do posturing, like they will do something like that, stretch their neck. Indirectly, it shows that they are uncomfortable with that. So, we diagnose that based on the clinical suspicion and history taking as such, and try to correct it. And majority of time, as time goes, they grow out of this problem. So maybe a dietary habit of giving frequent small meals and not to involve in major activity, physical activity immediately after food helps us. If you are jumping after a food in heavy meal, then there is a tendency of these food going up. So maybe you can restrict such activities, because reflux is a definitive problem and it is very much underestimated because the lack of symptom correlation and the investigation. See, you want to confirm reflux, then you have to do an endoscopy to see the food pipe and what is there any ulcer, or there is something called 24-hour pH study, which is difficult to do in our group of children. So, so this is the flaws in this part, and we can try, and with lifestyle modification and some tablets, we can control it very well. And the other huge thing is constipation. So we all understand that toilet training is an important part. Like even in a normal group of development children, they tend to have some disturbance in this learning process, and then they don't encourage the process of defecation. So what happens is the stools get accumulated in the large intestine like this. And one fine day, they will try to pass it out and it will cause severe pain, and they get frightened about it. And what they do is they voluntarily hold the stool and the process of defecation. So eventually, even in population, and even in adults also, they do it. But predominantly in children, we have this problem of having this habitual constipation, just because they hold the stools and then it builds up. So once they do it, it becomes a habitual constipation. So what is, again, there are a lot of other things also, dietary patterns. So if you don't give good hydration in the form of like water or fiber containing diet, because of the difficulty in feeding, we can understand that the stool bulk become too much, and then intestine walls absorb water from the stools, and then eventually it forms very hard rock-like stools. Sometimes when they pass, they may bleed also. So constipation is an uniform problem for all neurologically deprived and neurologically problematic kids and adults. So we have to make sure that some form of laxatives in diet itself, like fiber, fluids, has to be taken to have a regular stool pattern. If it is difficult, I know it's difficult because once they have that fear of passing motion, like they feel that letting out the stool is going to be painful, maybe we can encourage them. What I tell few of our parents is to even to encourage, sit along with them, and educate about the posturings. Indian toilet posturing is the best
Yes.
because it compresses the abdomen, flexes the hip, and allows this large intestine to align properly to expel. So it eases the process, and not to strain too much for a long time, because if you keep on straining, the process is going to be difficult. So we should not, the maximum strain, if it's 10, you should strain up to 5 or 10. So it's very difficult, but this is the process which we have to understand and then treat them. And probably you should give an incentive, like say you sit this time, you will be getting this. So you encourage them in the process, so that gradually, with the help of laxatives, you can pass, and slowly you can stop these laxatives as time goes. Because constipation is a major problem. Once you are constipated, you start feeling bloated, and then that indirectly affects the behavioral pattern as such. And particularly pain, there are many causes for this abdomen pain. It may be because of an inflammation of intestines as we get through routine infections. Like, see, mouthing is an unavoidable habit for children. So even otherwise, they just keep everything in mouth which is laying. So they will get in touch with infection very soon than compared to their counter children. Um, that's a major issue. And it's very difficult to find out whether the child is having severe pain. The parents closest, whoever is close, mom has an idea like what is the discomfort happening and whether there is a sign of pain. Then we have to take it further. And predominantly abdomen pain reasons are little bit of hyperacidity, which happens in children because of like fasting for a long time, not taking adequate diet, and probably, as I said, mouthing can cause infections in the stomach and intestines, which can give rise to such pain. And even otherwise, there are common problems which happen in normal individuals, like appendicitis or stones in the, so something like that which happens, or intestine rotations, hernias, all can cause abdomen pain. So we have to keep a close watch on the behavioral pattern to find out what is, and then probably we have to leave it to the investigation part to find out what is the cause of pain. As we discussed earlier, colitis, gastroenteritis, and worm infestation. So it's very common in this particular age group because, as we discussed, we don't have that much control over the mouthing part. So colitis, otherwise infectious colitis, if we find, we can get it treated. And there are proven evidence to say when children have these sort of infective colitis or gastroenteritis, there are particular mood change happens, and then sometimes say when they feel nausea, like vomiting sensation, they become socially withdrawn and they don't communicate well. So there are group of children who they have studied, and with the questionnaire they have asked the parents to identify what happens when they have these sort of episodes of diarrhea or constipation. So there are certain maneuvers they do, and we can identify that they are in a trouble. And worm infestation, yes, we can practically deworm them periodically, and if you have a suspicion, and if you are deworming, maybe as a family we have to do that, because you get reinfected very soon when you have somebody who is carrying that worms in, if a sibling is there, we have to wash and the bed sheets and the cloths which we are using, so they can harbor this ova and cyst of these worms. And that's how I think we are okay with talking in English if there is a trouble with somebody who.
Yes, doctor. If in case somebody wants it, we will make
Okay.
sure that it is addressed.
Okay.
So far, so good. Yeah.
So then other problems are sleep problems. So what happens is, like, say, particularly with esophageal reflux, then sleeping will be a nightmare, because when they lie down, what happens is the acid comes out to the esophagus and they have this heartburn and they fail to sleep or go to the deep sleep, which they are supposed to. And then it makes them irritable even otherwise. So that is also one major issues which we have to understand. And as I said, to common to all GI problems, say infections, appendicitis, gallstones, malrotation of guts, and many such things can even happen to them. So we have to keep a close watch on them. And finally, I wanted to tell about some alarm symptoms, like, say, something which we want to look into, that say having chronic problems of vomiting and constipation. At least we should take an effort to see why this is happening. Sometimes vomiting is mistaken, like you have a severe reflux, child brings up milk or something into the mouth, we assume that as a vomiting. May not be, it's just an volume reflex, like you have a reflex which brings out lot of volume. And constipation, for a long time we have to see why this is happening, because if you make a little change, there will be a betterment in the behavioral pattern. And if children has blood in vomiters or blood in stools, then it's a matter of concern. It can be, may not be a major issue, but something like an acidity related ulcers or a fissure. Anal fissure is a common thing, right? We just ignore it. And persistent feeding issues. This is because there is a chance of having a malnutrition. And when you find there's a change in sleep pattern, then we are a little concerned, and behavioral changes. And when you get obvious food allergies, then we have to contact healthcare professional for further. So this is just overview which I wanted to just have before we go into the question part. And I'll ask Dr. Chezhian to have something to add with this, and then we'll go to the question.
Yes, Dr. Arul Prakash, it's a very good presentation, excellent presentation. Almost you covered most of the issues our children are facing, and you covered both the common GI problems in general population also. Those things we most of us may not be experienced, but the food selectivity and other constipation, everything is most of the parents are facing. As a parent and gastroenterologist, I want to say a few things. Actually, our children are not able to communicate. One of the important thing to the parents is we are the primary caregiver, are the responsible to identify the symptoms. We have to watchful of all the activities of our children, especially what is the problem this child is really having. So we have to observe and identify. For example, so I am a father of one of the highly challenging food habitat child. So my son used to have problem at every level. So eating. So what is eating now? Eating means taking the food from the plate to the mouth. That is called eating. So he has a problem in eating. So he chooses only certain foods. By seeing, he avoids majority of the foods. Okay. So then there may be a problem of chewing. Chewing may be a problem. So the parent has to observe. So I observed my son, and I'm saying that. So the problem, you have to identify whether the problem is in the eating, or in the chewing, or whether in swallowing, or after that, whether he has any complaints after eating. He's non-verbally, he may communicate by holding the abdomen. So they may not feel the pain very as normal as other persons. So they may indicate indirectly, even though verbal child also may not able to communicate by correct appropriate terminology. Because my son used to sing a song, you can so many things you do. You cannot call him as verbal because he is not using his language to say what is he suffering from. That is important. So this is one important point I want to emphasize for the parents. So you have to observe the child at every level of eating where he is the problem. Then you have to observe his bowel habits. You have to watch whether he is daily going to the toilet, whether he's just there are for so many reasons they may go to toilet, but we have to observe. Then we have to see the stool. So whether it is passing a normal consistency stool or a loose stool, or whether the stool contains anything like that. That is also our responsibility. Even though it's not possible, actually, I know that it's not possible to see the daily on daily basis. Whenever it is possible, I know we have we have so many other responsibilities. We have a lot of difficulties, but we have to focus on and observe the child for the issues. Then only we can identify the problem. After identifying the problem, only we can correctly go to the correct doctor to get the treatment. So because our aim is good nutrition. Nutritionally, our child should be healthy. So adequately, according to the age and body weight, height, you should have no deficiencies, and all the nutritious body things will be there. So for that, we have to observe the child at least periodically and identify where is the problem and proceed. That's my one of the point I want to emphasize. Thank
Yes,
you.
yes, Dr. Shane. What you said is right, absolutely right. And the parents' purview, probably we have to keep a close watch in what they are doing. And I did forget to add something about the foreign body. Dr. Shane, do they, I mean, have access to things like, do they just
Yeah,
take,
yeah, yeah,
and there are
definitely.
particular kids who
Definitely, they used
just
to keep some for any object in the hand, in the mouth. So it's always there is a chance of ingestion of foreign bodies, and that may get obstructed. That is possible. We are one of the risky group.
Yeah, so yeah, maybe sharp objects or tiny objects, which we should not leave that around. Probably, I mean, it's very difficult, I know, but if it gets ingested, then we have a concern of how to remove it. Generally, most of the things which is, I mean, smaller size tend to come out if it's not sharp and inert objects like biologically not like batteries and all were harmful, but the other thing we have to be very careful in that part.
Yes, yeah, I agree with you.
Okay.
And as you said, we have all the risk factor for any GI problem. So majority of the parents, for majority of parents, sleep may be a luxury. Okay, continuous sleep uh, for all the days is not possible. So same happens to children also. So if you have any sleep disturbance because of the child, and then you develop any GI symptom, the same symptom may be there in the child also.
Yeah, exactly. Even for us, like if you don't have a good night's sleep or you are stressed, your bowels react weirdly. Like you will have frequent stools, you will feel bloated, you will feel like giddy. So you can express that to someone, or I mean, at least, but what the kids will do, they will react to that. I think it's all more of that. And then comes the other added big problem was this food allergy and the choice of food, which complicates the whole thing. And this food intolerance is a very complicated thing to understand, even for people like us, because the presentation is really weird. They won't present you with immediate reaction. Some food, if you are, there are two ways of this effect happening. One is through a process called cell-mediated immunity, or the another one is antibody-related. Antibody-related, it shows its effect immediately, and cell-mediated takes a little longer time. So maybe if you are taking milk for a long time, or say like peanuts or something like a day, maybe like seafoods or something like that, sometimes it shows very fast and then you try to avoid it. Otherwise, they will be having some bloating, flatulence, belching, some discomfort, which is very difficult. There are investigations to find out, but it's not foolproof. There are food allergy panel where we can do in the blood test, particularly for wheat, dal, legumes. There are many adults even having allergic to dal. So but you won't believe it if unless we find out and say that it's because you are taking it daily and you assume that the whole world is taking that, they are not having any problem. Why should I? So unless you find out and avoid it, it's very difficult. So there may be very small issue which is there, which is like under our nose, and we are like ignoring it. So that is a possibility. I think food allergy, intolerance is a problem. Dr. Cheyenne, do you think so? Like it plays a major role, right? I mean,
Yeah, I agree. Actually, adverse food reactions can be. I believe we can face everything. Maybe over a toxic dose of food also is possible in our children, because we don't know how much he needs. Sometimes we feed him continuously because eating is defective. Sometimes we feed him directly. In that case, he will open his mouth. He never felt it. Satiety. He never felt satiety. I opened his mouth. One day I found that we full stomach. More than that, he vomited after the food. We are not able to recognize.
Yeah.
Communication is problem, no. So, but food toxicity due to overdose is a issue possible in our children. Then adverse food reaction like food allergy. You said no, food allergy. Food allergy may be easy to recognize if it is severe only. Rashes and other things occurs in only very few percentage, IG mediated food allergy. But other intolerances also very difficult for our children, because they don't know whether they have abdominal pain. We don't know whether the child is having abdominal pain or bloating. We don't know. Maybe some, as you said, some abnormal posturing or abnormal behaviors may indirectly point to food intolerance.
So yeah, one way of handling that, which we give to normal people also, to maintain a food diary, say that you have given such things today and they have some abnormality, what you feel like abnormal. Maybe you take a note of it and keep it, and then we reintroduce another day and see whether it's happening again. So that is the best way to find out whether it's complicated, but that is the only option, I believe, because blood tests may not show everything, and sometimes it may fool us also. There may be an abnormal in the blood reports, but they will tolerate that.
Yes, Prakash. I discussed this food, but you rightly said that test may not indicate the disease. I discussed this point with one of my friend at UK, Manchester. He's a food allergy specialist there. He said allergy test may be positive in so many. It may be positive. It may be showing allergy to so many food varieties. It may not be real allergies. There is this difference between food sensitization and food allergy. So we have reacted to so many food slightly. That may be called as food sensitization. That may show as positive in tests. But food allergy is a clinical manifestation. That is important. So if you really have a clinical manifestation like rashes or some oral swelling, severe urticaria, or some abdominal bloating or pain, diarrhea, if there is a symptom only, we can respect it as a food allergy. Otherwise, it may be a sensitization. We need not restrict everything. Test is always misleading.
Yeah,
that's
true.
My point.
Yeah, true. That's true. Even all this investigations available is not foolproof. Should we go for the questions, or we
Yes,
will
doctor.
how to organize?
Yes, doctor.
Madam, you can also share some points regarding
your experience and
you are an occupational therapist,
Yes, doctor. So yeah, I would just add on. Summary has given us, drawing the parallel between the neurotypical as well as the neurodiverse. Though you have attributed everything for neurodiverse children, it's not much different from neurotypical or as adults. So that has really opened our eyes, I would say. And very simple practices like maintaining a food diary or the allergic test is not a foolproof thing. This is also bringing us much solace, I would say. So without further thing, we will go to the questions, doctor.
Yeah.
And
yes.
Okay. So the first one is we have as you have seen, we have divided these questions for is the diet-related questions, food sensitivities is one, and then general ones. So I will go over the diet-related questions first. Can you please suggest food or ideas to keep our kids' digestive system healthy?
It's a difficult question, basically. It depends on individuals. So as I was discussing, there are a lot of bacteria in the intestine which determines the health generally, not only with the GI health and mental health, or I mean any other organs for that matter. As I said, liver and other structures are closely connected with the intestine. So the bacteria determine the nature. So I don't think there is any specific food item, and it's a balanced diet, basically the carbohydrates, protein and fat, and with vitamins and minerals, which is very difficult in our scenario because of the feeding difficulties. But having said that, we have to have a significant portion of vitamins, that is through vegetables, which has an added fiber to it.
Okay.
So probably that is the best diet I can suggest. So coming to that bacteria in the intestines, there was an article in the Nature claiming that there is something called fecal microbiota transplantation. What they do is they take healthy stools from the healthy, children. They take stools and then they screen for infections and all major transmittable infections, froze them, and they replace to children who have disease or illness.
Okay.
So they have documented that after this transplantation, microbiota transplantation, they do well, very well, but it's all like preliminary and few case reports, and it's not proven. So maybe the future, is there like in controlling the, gut bacteria, like they give them that and then they do well. So in fact, and it differs between in area, region to region. Like say in our country, probably things are very different. So we have to wait and see. Yeah. And it's very difficult to suggest a particular diet pattern. Yeah.
So doctor, one small thing. If you are done with presentation, we would like to see you better. So could you just close that screen share?
Oh, okay. How to?
You could just stop presenting.
There is an option called stop share.
Stop share.
Yeah. I found out. Sorry. Is it okay? Better
yes,
now?
Yes. Very much. Thank you so much.
So I want to give my view regarding the first question. So can you please suggest food or ideas to keep our kids' digestive system healthy? Okay. Ideas maybe we have to eat we have to eat slowly, and you have to chew properly. Then you have to drink a lot of water. Actually, ideal water intake suggested is 30 ml per kg body weight. That is 8 glasses. So you have to hydrate properly. Then you have to avoid certain foods like fried foods, bakery items. So those things may be not good for the gut.
Sure.
Okay.
Yes, doctor.
Then we have to, as Arul Prakash said, you have to take balanced diet. Balanced diets, I think we will discuss later also. Balanced diets means, so to understand for the parents, it contains at least, so all the components adequately. Carbohydrates, proteins and fat and fibers, everything should be in adequate amount. For example, an adequate, correct combination is 55 to 60% of our daily diet should contain carbohydrates. That carbohydrates should be complex carbohydrates, not a simple and refined carbohydrates. Then proteins intake also, you should take at least 1 gram per day, 1 gram per kg per day, according to your child's weight you have to calculate. Then fat you have to take, mostly you have to take fat, maybe saturated fat or polyunsaturated fat. So many things are there. The ratio, correct ratio, everything is to make the digestive system healthy only, I'm saying.
Yes, doctor.
Actually, you have to divide the fat into 3 things. can take 10%. I said 30% is fatty food intake per day allowed. Among this, 10% is saturated fat, and 10% may be mono unsaturated fat, and 10% may be polyunsaturated fat. So this is how we have to calculate these things. Are you have to see what are the things which is more available in our food. So it's a big task. Actually, nutrition, as Arul Prakash said, a dietitian may be more helpful in this regard. Then we have to follow all the common healthy practices, like clean nail. Like, you have to keep the hands healthy, washing the hands. Everything is important. Actually, because we have so many other challenges, we may forget to ask the child to wash the hands, and it is not easy to cut the nails for our children. So we may not be properly doing it every week. So if you miss it on Sunday, maybe it is postponed to by another week, because it is a long session. It's nail cutting for Dr.
That's a
Arul Prakash.
challenge.
Nail cutting is really a big challenge for our children. So
Yeah.
sometimes it will take half an hour. We have to pray him. We have to
Reward him.
reward him. We have
Yeah.
he choose the parent. I never in my 17 years, 16 years of
Parenting.
my parenting, I never cut nails. Only it is a responsibility of because I offered, but I'm not allowed by the child. Okay, so it's so many challenges. So everything is every traditional habits is making your digestive system healthy. Our digestive system means, for parents' sake, I'm saying digestive system means start from the mouth to the anus. It contains the esophagus, the food pipe, the stomach, the small intestine, the large intestine, and some of the digestive organ like pancreas, then liver and gallbladder. These are the thing we call as digestive system. So among this, every organ has some support for being healthy. So for large intestine to be healthy, you should have a good bowel habits. You have to pass the stool daily. To make the large intestine healthy, you have to pass. You should avoid using the prescribed laxatives. You have to increase your physical activity, take a lot of water, and you have to take adequate fiber, a lot of vegetable and fruits to make the bowel habits regular and make the large bowel happy. For small bowels, you should give uh, adequate correct food. Boiled foods are okay for small bowel. Then some raw vegetables and fruits are okay, but some fried things and other refined foods are not okay for the small bowel. As Arul Prakash said, the more emphasis on gut microbiota. So for gut microbiota to be healthy, we should avoid unnecessary tablets. Over-the-counter tablets you should not take. Unnecessary antibiotics you should not take. We should have a very good pediatrician consultant for a child in case of any infection. Most of the time, antibiotics are not required. I think
Yes,
I
correct.
think I think Arul Prakash will agree with me. Uh, Pediatricians has a tendency to prescribe high dose of antibiotics whenever a child comes with fever. Uh, but
Randomly.
we should be lucky to have a very good pediatrician who is not prescribing antibiotics. So
Randomly.
my second child Anish have never been prescribed antibiotic for the past 8 years. He's 8 year old. Not even a single, like only symptomatic drug, paracetamol or some antihistaminics. Those things are enough. So he received all the vaccinations. He never received any antibiotics. But my elder one, the special he received antibiotics in initial days, because we were in the village during the first 3 years of life. Those days, the pediatricians will give antibiotics immediately in village side. Maybe think we should have a very good pediatrician for gut health also. That is also important.
Understanding the whole process. Yeah.
Yeah,
True.
that is also very important. For stomach, we have to avoid overeating. High volume of stomach to be healthy, high volume eating is to be avoided. Some spicy foods that increases acidity has to be avoided. High fat food also should be avoided. So everything should be balanced. For food pipe to be healthy, I mean that esophagus to be healthy, you should drink a lot of water. Whenever you take any tablet or food, followed after that you have to take a lot of water to flush out the food pipe. Otherwise, some tablets will stuck up in the food pipe. It may cause ulceration. We are seeing a lot of other such things in our day-to-day practice. So to make everything And for pancreas to be healthy, I think our people have pancreas, healthy pancreas, because pancreas will be affected only by alcohol and smoking. So we are not exposed to that.
That way we are fortunate.
Liver, for liver to be healthy, you have to take again. You have to, that is alcohol and smoking. Those things are not a problem in our child. For gallbladder to be healthy, should not avoid meals. Skipping breakfast is wrong, and skipping meals is wrong. Suppose sometimes out of a difficult, challenging situation, you may not feed your child in one day. பரவாயில்லன்னு சொல்லி ஒரு வேளை விட்டுடக்கூடாது. So something you should have. So periodical eating pattern should be there. The frequency should be there. So other things, these are the ideas to keep the digestive system healthy, and we have to follow the balanced diet as
Doctor has.
Prakash said. Okay.
Yeah, that was excellently told about digestion starts and oral cavity. I think chewing is an important thing. I mean, it's very difficult to make them do that, I think. So, I mean, that helps a lot of people to have an easy digestion in the stomach or the, and the texture also, do you think, like how to prepare, like, is there anything like you give very much boiled, or is there anything like that in preparing specially for the kids?
Yes, doctor. They do have, just like the